So welcome Sri, welcome Dr. Madan, and
Yeah,
welcome Dr. Rakesh.
Thank you,
Uh,
Santosh.
thank you, Santosh.
let's get started with Dr. Madan. Dr. Madan, you have a very interesting background as a physician, of course, but also a thought leader. When you see some of these emerging technology innovations in healthcare, what do you see? What are your views about them?
Yeah, if you will see that recently what happened is COVID taught us a lot of things. And same here in the COVID, we learned that healthcare technology is very, very beneficial in providing health services. So before that, just what was our experience that we were not using so much of the technology in healthcare, and as such the last year we have seen there are few aspects which healthcare technology has given, and like teleconsultation and online OPD registration, e-pharmacy, and various health and fitness app. And there are many apps which are even helping the elderly to book their slots for consultation and physiotherapy slots. So I think this healthcare integration with the technology, it is very promising and have a great future. So, for example, if you take, I am an associate professor in orthopedics and I have special interest in technology. So, whenever I operate a patient, so these orthopedic patients who are undergoing these joint replacements, and they have a long-term follow-up. So, our follow-up starts from the day when the patient gets discharged from the hospital, and then he comes back for the review at 15 days, then at 1 month, then at 3 months, then at 6 months. So these follow-ups can be reduced with the help of technology, and whenever whatever we can do so to reduce the physical interaction with the patient, and we can sort out his problem through the technology on e-platform, then that is the best for him, because nowadays it is very difficult to spare time for the attendant to come along with that and visit the doctor. And it is very convenient for a patient for each and every single doubt about his treatment, his surgery, and what are the precautions he want to take. He can immediately get access to the internet and talk to the doctor. See, like if a replacement patient have a doubt regarding whether he can take the side roll or how he should get up from the bed, and everything is available through online mode, and there are various platforms through applications and WhatsApp. He can connect with the doctor and immediately gets his doubt resolved. So I have many patients who are presently being operated and they are coming for a regular follow-up, and they have doubt, then they just ping me up and I prescribe that, clear their doubt, and give them advice. So what else is required? So that is the best benefit of technology, I think.
I think that's a fantastic example. I can imagine the ease of access that can happen with such innovations,
Yeah.
but also such thought leaders as you who are using these in real life, as you have shown through the example, is really fascinating. I'm going to go to Sri now and see, you have observed and viewed and studied this changing landscape in overall in technology, but specifically for healthcare. So why did you think about setting up REAN Foundation for healthcare? If you can explain us the vision.
Yeah, Santosh, as Dr. Madan already said, the need is evident. I think everybody understands that the need exists today. I happened to face this need almost 13 years ago when my mother was diagnosed with leukemia. And she was in India. We went from our town to a city. And what I found myself doing at the time was, we had the fortunate, we were fortunate enough to have the diagnostic center come to our house and take a blood sample, Then I would take the report and take it to the doctor, and the doctor would change the medication, and then pharmacy would deliver medicines. And this is 2007, right? So this remote delivery that we're all talking about as a result of COVID actually existed in India all along. At about the same time, I was working for Centers for Medicare Medicaid, which is equivalent of Ayushman Bharat-like program in India. And I was participating in health technology in the US. And at that time, all the new digital health technologies, and especially in continuity of care and preventative medicine, were just taking off. So I thought it would be nice to be able to apply some of the knowledge that I have working with Centers for Medicare Medicaid here to the India context, because India had the luxury of delivering, medicines or getting the lab done at home, and that's how my vision started. Right? But it took me, almost 13 years, so I can prepare myself, be resourceful, gain the appropriate knowledge, and now I find myself doing this in the midst of, the whole with. The technology improved a whole lot with machine learning and other things and wearables. It has become even more practical, even more possible, like the way Dr. Madan was saying. And I feel really fortunate to run into people like Dr. Madan and Dr. Rakesh and you, Santosh, that understand this field and understand, especially in the India context, understand all this. So that's why we started doing it right now. Yes.
That's a fascinating vision, Sri, and really makes it more realer again with your personal experience that you shared with us. What also strikes me is about the timing that you spoke about, and I think that's also so real. The technological advances somehow help, and as Dr. Madan mentioned, the growing need from patient side because of the pandemic kind of also underlines the whole issue very well. We are going to come back about some of these details to you, but before that, let me also get in Dr. Rakesh. So Rakesh, as a practitioner, as a physician, but also as a part of REAN Foundation's physician technologist, which is a very interesting role, I must say. What are some of the current projects that are leading at REAN?
Thanks, Santosh. Basically, REAN Foundation's goal is helping society in holistic healthcare using technology, basically. And holistic healthcare means that we want to help society not only manage disease, but also help in preventing and detecting disease in early stage using technology and creating awareness about the common diseases. While creating technology-driven healthcare, we always focus on augmenting the traditional way of healthcare with easy-to-use applications, so that elderly population do not face any issue. To help to fulfill all our goals, we have developed many different applications and tools to handle different aspects of healthcare delivery. Many more are in pipeline. Basically, our aim is that prevention is better than cure, and we want to implement this preventive healthcare on topmost priority. The good nutrition, regular exercise, and sufficient sleep are the three pillars of wellness and primary prevention. And we want to make these three pillars habit of every individual, so that long term they can be freed from all kinds of disease. So we have developed many applications. One application is that REAN Health Guru app nutrition calculator can help in calculating how many calories the patient or person has consumed, and it can automatically detect calories burnt out using the Apple Health and Google Fit applications, so that they can adjust their consumption accordingly. And many more advanced features in these nutrition steps are in pipeline, like intermittent fasting feature. Dr. Madan said, COVID-19 has changed a lot of things in the healthcare era. So we try to help the society by developing different COVID-19 related applications. One is the vaccination one, like COVID-19 vaccination appointment availability checking. When government of India launched vaccination like campaign, there was a lot of queries and anxiety among the people to know like if vaccine is available around them or not. So we developed a bot to check the availability of the vaccine in nearby center. The unique feature of this application is that they can simply send their location and see the vaccination availability around their centers. Another feature we developed is COVID-19 risk assessment board. When I like saw patient in my routine life and in my OPDs, I saw that most of the patients have anxiety to know if they get COVID-19 positive, how that's going to harm them, like what kind of risk they have. So we developed a risk assessment tool. Using that, patient can assess the risk of disease getting complicated in case someone get infected with COVID-19. And using this tool, person can assess his risk and plan his daily activity to shield himself. Like he can avoid like a crowded place if he's at higher risk, like the elder population. Another thing we see that like during the COVID-19 time, lot of people have lot of questions regarding the COVID-19, like how it's going to harm them or what kind, like how pregnancies are like prone to have COVID-19 positive, etc. So we developed the COVID-19 frequently asked question board through which patient or person can ask a question related to COVID, and answers we have given are from authentic source like WHO and CDC. Another feature we have is that REAN Foundation blog, where we are delivering highly curated content from our experts to like fulfill these three pillars of wellness, like good nutrition, regular exercise, sufficient sleep, so that we can prevent from disease. Even with best efforts, sometimes primary prevention fail many times, leading to secondary prevention stage. Most diseases come with like warning sign and symptom. If we can detect those warning and sign and symptom at early stage, then we can control the disease progression and hence the limit the damage like diabetes mellitus, hypertension, cardiac disease, etc. So we have developed a REAN Foundation forum, which is helping people to discuss their sign and symptoms. The forum allows experts to answer specific user queries as well as provide a platform for those who are like managing an illness or chronic condition to share their experience and practical tips that could help others in similar situation like cope better. Like we said, COVID-19 symptomatic assessment tool, which is another thing with web for like COVID-19, using which help user identify the symptom of the suspected case of COVID-19 and help to decide like when they can need to contact the nearest healthcare facility or they can be monitored at home. Like during COVID-19, I got a lot of calls from many different patients. Most of the patients have anxiety to like if they should go to the hospital or not, so especially when their like bed availability was scarce in hospitals. So this COVID-19 symptomatic assessment tool will help with like decreasing the load on the hospital because patient can decide like if they need hospitalization or not. Another tool will develop is that anemia detection using a smartphone. Basically, anemia is very common disease in society. Like approximately 40 plus population in the world is suffering from the anemia, especially the females. So aim of this project is to screen anemia using pictures of different body parts at affordable cost without any specific medical equipment. It can help in self-screening at home, like patient can take picture of eyes, conjunctiva, a nail, palm, and like our artificial intelligence and machine learning bot can tell that if you are anemic or not. Another benefit is that we can mass screen the patients in the camp in a remote area. Another feature if any case patient unfortunately need to take medicine regularly like in hypertension and cardiac disease, then our REAN Health Guru application help in increasing the compliance by allowing user that set auto reminder to take medicine. Like patient can input the medicine detail in our application, then application will send reminder at specific time to take the medicine to remind that you should take the medicine. They can also record the vitals like BP, pulse, oxygen saturation, temperature, so that they will be able to view the body's performance over a longer period of time, like weeks or months. And they can even share this data to their doctor, family, friend, and everyone else they want. Another feature is that REAN Health Guru Symptomatic Monitoring created by the we have created this application based on AHA guidelines for the heart failure patient, can help the patient understanding how well they are performing. They can like monitor the symptom, like how they are feeling today, or like how is the tiredness, etc., etc. And besides these features, patient can securely store prescription, investigation reports, etc. in our application, so that they can quickly access in future whenever required. Our application is HIPAA compliant, so patients do not need to worry about like privacy of the data.
That's excellent. Thanks a lot for that fantastic overview of all the features that we are working on. That sounds like a lot of work for the team. And from my experience working with you, but also with the rest of the development team, I'm very confident that all of these features, but also all the future ones, are going to be super helpful for patients. One thing that is very evident from how Dr. Madan, Sri, and you mentioned about all the features and REAN's vision is about how to ease access for some of these services, some of these thoughts to the users and patients. But I also know that you are very passionate about affordability, and you're working on a project to develop something on the theme of generic medicines. Can you give us a glimpse of what you're working on?
Yeah, thank you. Basically, I usually say like accessibility has no meaning if it's affordable. Suppose some costly mobile phone is in market, but we can afford to buy that mobile phone. So that's useless for me because I cannot afford that. Same thing in case of healthcare. If healthcare is accessible, that does not mean that it's also affordable. If like a poor person cannot afford some treatment, then there is no meaningful thing for him to like go to hospital. Even one study was conducted by the Department of Pharmacology, Maulana Azad Medical College, New Delhi. They have shown that medicine can account for approximately 90% of healthcare spending by the poor people. The higher cost of medicine contribute to decreased access to healthcare. Many patients in chronic disease leave the treatment midway because of the cost of the medicine, not because of the availability of the doctor, because they cannot afford medicine in long term. And studies say that wide variation in the medicine price may result in prescribing those brands which are more costly. Like sometimes same medicine or generic molecule is available at cheaper cost, and same molecule can be available at higher cost by other brand. The burden of such prescription has to be borne by the patient and his family. It was observed that depending on the brand of the antibiotic prescribed in case of acute pneumonia, a daily wage earner might have to work for approximately 1 to 3 days to purchase that medicine. So suppose like patient gets sick and he has to spend a 3 day earning to like get treatment. That's like big burden for that patient. And according to my experience, when like I passed my MBBS and I see the like clinical environment, I see that biggest reason of like high cost of medicine is because of lack of awareness about the generic medicine. And among the population, the people do not know what is a generic medicine and what is the difference between the generic medicine and other branded medicines. And another reason is the non-availability of the information about like where to buy this generic medicine. Even government of India has launched a campaign like Jan Aushadhi centers to provide the generic medicines. So in 2011, I thought that I should solve this problem of non-availability of the information of the generic medicines. So I launched a website, genericpedia.com, to create awareness about the generic medicines. And on that platform, patients can compare the cost of that medicine with other brand. And like people like this concept a lot. Basically.
That's excellent. Thanks a lot again to talk about that one. I'm going to go to Sri. Sri, we heard this fantastic overview from Rakesh about the work that we are doing at REAN. Any additional thoughts from your perspective about, especially our focus on home-based care delivery and self-care?
Yeah, I think I just want to summarize everything that was told until this point, mostly. So really the vision of what we are trying to do is around 6 pillars. 3 of them are health related, 3 of them are wellness related. So for any health condition, it is important to make sure that patients are taking their medicines and medicines are available, like Rakesh just said. That's medication management. Vital management. So if you're a heart failure patient, you need to check your weight. If you're a COVID patient, you need to check your blood oxygen levels. Those are vitals. Then there is symptom management. So I may have chest pain or nausea or shortness of breath, right? So those are symptoms. So these 3, medication, vital, and symptoms, are any health condition oriented vitals that need to be, or pillars that need to be managed. And the remaining 3 are both very important for people with health conditions as well as just regular wellness. And they are, one is food or nutrition management. Second is exercise and activity management, like walking, running, etc. And then the last one is stress management, right? So what we are trying to do, and these have been known to be the key pillars in public health, preventative health, behavioral health for a long time. And they're not easy to solve. So for example, as a congestive heart failure patient, you are supposed to monitor your weight every day to detect for fluid accumulation. If you don't do that and we end up getting hospitalized, for example, even in advanced countries like the US, that is a $40 billion a year problem, right? But more importantly, there's a 1/3 chance of a person dying when they get admitted into hospital for that procedure because of the infections they catch and so on, right? So while it is easy to ask someone to check weight, it's very difficult to do on a daily basis. It's almost like asking someone to just wear a mask to protect yourself from COVID every time is easy to say, it's very difficult to do. So what we are trying to do is, how can we make it part of lifestyle? So hopefully a patient, if they sleep on their bed and get off the bed, their weight is taken. So they're not bothered by taking that weight. Someone else is constantly monitored, right? So those are the kinds of solutions that we want to bring to the table. And like what Rakesh just discussed, his 11-year-old journey about bringing that, making medicines affordable, we want to try to make it accessible now on WhatsApp in any language that people can request, or just taking a picture of the prescription, right? So we can figure out a generic medicine. So that innovation to make it very accessible, very easy to use, is really what our focus is going to be.
And it is very evident that all of these has a very strong technical foundation that will be built upon, right? And we will come to that.
Absolutely.
I'm going to again go to Dr. Madan to get his views on the home-based and self-care perspectives that Sri and Rakesh talked about. Doctor, what have you seen from your perspective?
Yeah, as per we see that how it happens, Dr. Rakesh rightly said, accessibility does not mean affordability. So, see, accessible is available, but patient is not able to afford that. We have to balance this, and that can happen in various aspects if we can do it at self-care level and primary healthcare level, preventive healthcare level, and follow-up level. So if we will see self-care as she rightly said, that they are working, the REAN Foundation is working for the lifestyle management and for making things for the patient, for the person healthy. So the habits which are very difficult, and on doing that daily basis, it takes a lot of effort, and having a companion which is always 24 hours available with you, will help a lot. So if we will take in chronic diseases, say I have a patient of diabetes mellitus, and with technology, there can be set reminders when to take medicines, what are the time and how much interval you have to go for a lab test, even at their comfort of home. If the test is required, they can directly through internet they can book their lab test, and even these reports can be sent to the concerned physician. So a lot have changed from that visiting clinics and providing healthcare on the for remote areas, even the patient with chronic diseases, and they are using now health platforms. And yes, she rightly said that it took a lot of time, and the pandemic had taught a lot of things to us. And the teleconsultation that was mandated by Medical Council of India on the verge of pandemic, that COVID came, and then they allowed. But I think it should have been done earlier, and if it is a boon to the healthcare industry, and the integration of IT sector is required, and so that is why I feel that it will surely help that digitalization of healthcare have a long scope and wide scope in improving the health condition of citizens of India.
Dr. Madan, you make an important point about especially the resource constrained perspectives about the access, especially in rural areas where there is a lack of personnel or lack of facilities, and so on and so forth. I'm going to go to Dr. Rakesh now, and also bring in an important perspective from his practice and from what he has seen in the field. And so, Rakesh, you have also some thoughts about how caregivers are influencing the way use of technology can help users and patients. So, can you share your thoughts on that?
Yeah, like Dr. Madan said, after COVID-19, technology has like a new boom in healthcare sector. Major reason was before COVID-19, technological involvement in healthcare, there was biggest barrier was healthcare regulatory agencies. They were not allowing the technology to be used at a scale that should be used. But after COVID-19, healthcare regulatory agencies around the globe have accepted a different mode of remote healthcare delivery, like using the different technologies. But also, general public has also accepted this new technology in healthcare. Before COVID-19, patients were hesitating to like having teleconsultation with the doctor online. But after COVID-19, not only regulatory agencies has like authorized this teleconsultation online, but patients are more willing to have telemedicine more like instead of in clinical visit. Telemedicine has revolutionized the healthcare delivery not only in the rural remote area but also in case of patient of chronic disease in urban area. The biggest benefit of like telemedicine in urban area is that it saves a lot of time to travel. Like if say sorry, if say metropolitan cities like Delhi and Pune or Mumbai, the time taken to travel from home to the doctor is the biggest like percentage of time spent in the consultation, and this telemedicine mode is saving that time a lot, and that amount to money. If I usually say if time is saved, that means we have saved the money, and so this is both economical both for both the patients and the doctor also. And even one another benefit of telemedicine is that it's saving the hospital acquired infections. Suppose a patient is visiting a clinic, then there's some chance that patient acquired some infection from hospital due to other patients, and this telemedicine is saving the patients from these hospital acquired infections. And remote ICU, like earlier days, ICU in the rural area was like very difficult thing to set up because of the qualified intensive care physician availability. a scar in the rural area. Now, remote ICU is helping healthcare facilities to provide service to even the remotest area. Intensive care physicians sitting in the urban area can monitor the ICU in the remote area and guide the healthcare provider to manage the patient in a better way. As previously discussed, REAN Foundation providing an easy-to-use platform that can be used by individuals and family to easily manage and control a chronic condition. It uses mobile technology to help the patient understand their disease better, record their daily vital data, like Sri said. They can monitor the weight, like in case of congestive heart failure, and like adherence to the medicine prescribed by the doctor can be efficiently managed. Using the REAN Foundation forum, patient can have access to expert insight, like to help resolve different queries sitting at their home. Like REAN Health Guru app has option to store, like I earlier told, medical prescription and investigation that make very easy to share if required in case of consultation from other doctor or secondary opinion.
So those are very elaborate points about how some of these things are changing. Also, considering some of the restrictions that were brought in due to the pandemic, I think some of these points become extremely useful to consider as well. We are going to go to the next session, but in the meantime, I also have one last comment about the remote healthcare, telemedicine sort of aspects. Sri, you had some thoughts and perspectives about how some of these things are changing. Would you like to opine on that?
Yeah, I know. It's not so much about changing, Santosh. What I really, because of the way people are, hearing about telemedicine, especially the first thing that comes to mind is a video consultation with a specialist or a remote surgery with very high bandwidth requirements. That actually requires a lot of investments, it's expensive, right? But what I want to clarify is it is equally important to follow up. Let's say that someone is able to conduct a surgery remotely, and which might take hundreds of thousands or even millions of dollars of investment to make such a thing possible. And I got some heart surgery done using that, right? It doesn't mean just because we threw away, lakhs of rupees, you're automatically good to go walk and, you're up and running, right? It really depends on how somebody follows up, right? Have they taken their medicines properly? Have they been checking their weight properly? Have they been eating properly? And it almost like Dr. Madan first said, there is a need for that 15-day follow-up, 1 month follow-up, 3 months, 6 months follow-up. And it's true of any condition. And it's that follow-up that is almost more important than what you just got done in a heavy surgery. And that follow-up, on the other hand, can happen with basic internet access that everybody has these days. Just basic WhatsApp access, not even a smartphone, not even a smart app, right? So what we are insisting on is making that available so that, the money that is spent on these expensive surgeries, the so-called focus on telemedicine, is really fruitful. Right? So that's the main point that I wanted to clarify, because most of the time people are thinking that we're bringing doctors and we're bringing telemedicine and we're bringing these fancy things. But what we are really after is making sure that the patients are following doctor advice, and the outcome, the result of those surgeries really makes a lot of sense.
That's an excellent point, and the means should not become the end point, sort of a thing, right? It's we should think about technology as an enabler, but not really completely focus on it. So that's an excellent point.
Right.
Okay, we are going to go into the next section of this webinar, and we are going to talk about a little bit, India-specific aspects, especially because Dr. Madan is with us. So, Dr. Madan, I know that you work very closely with the national authorities NDHM program. Can you give us a glimpse of what's happening there with National Digital Health Mission?
Yeah, as we discussed earlier, see, before COVID, we never realized that healthcare technology is so important, and that was first initially taken up in 2019 when National Digital Health Blueprint was released. Eh, This blueprint, what I specifically feel that should have come 10 years earlier, but because of this, at least we realized, and after teleconsultation was uh, given access to each and every doctor connecting to the patients, that was realized, and then it took a lot of rounds of consultation. This blueprint was later converted into a mission, and that was released into 2020 and as National Digital Health Mission. So it was officially inaugurated by our Honorable Prime Minister on 15th August 2020, and presently it is in various consultation stage. And it is having round of consultation. Till date we have 4 rounds of consultation, and what we are doing is we are inviting all the public and private healthcare providers, users, technology service providers, and common public. Everyone have they are the stakeholders, and we are inviting all the comments, and we are looking after all the possibilities, we are looking after all the challenges, and we are in a process to make a robust, secure healthcare digital platform, and that should be universally acceptable and applicable, and the data which whatever we get from the patients or from the technology provider, they can be transmitted securely and in a universal language. So we have a long path to go, and at least we have started working on it, and soon we will come out with fruitful solutions to everyone, every stakeholder who are involved in this. Let it be the pharmacies, let it be the technology service provider, let it be the doctors, let it be the hospitals, let it be the councils, and they all will come on a common platform, and they can use them freely, and everybody can contribute to this mission, and we can have a secure service, and we can provide this with the data security that will be good, and the internet access will help the healthcare delivery to remotest of the area. That is the our aim.
That's an excellent overview, and I definitely know also, observing this space, it's being done in a very open consultative manner. So
Yeah.
that's also really a welcome step about NVHM. Sri, what do you think from technology perspective, but also policy perspective about National Digital Health Mission India, but also such other policy initiatives around the world, and how can REAN contribute to some of these things?
Yeah, I mean, I think that is the most exciting part. Since the introduction of Aadhaar card, right? All these initiatives that have been really spearheaded by Nandan Nilkantani, right? And or as as early as 2 years ago, if we see how India went through the UPID, right? Universal Payment ID, and how it changed the financial services landscape in the world, right? I mean, I don't think it's a stretch to say that India is by far, at least among the leaders, among the most advanced countries in terms of how we deal with financial services. But these are happening on the framework of Aadhaar card and the digital missions. Now, the next big frontier is the digital health mission. And interestingly enough, actually, the digital health mission has has been kicked off even pre-COVID. It just happened that COVID is giving it a big boost, right? And the fundamentals of NDHM are absolutely the right fundamentals and framework. So, for example, even to date, I would say almost 13 years after health IT initiation in the US has been picked up as the first shovel-ready project in President Obama's administration at the 2008 crash, when US pumped in a lot of money into these projects, right? One of the things that we struggle with today is interoperability of health records. So what I mean by that is, I may have my health record in my primary care physician, and then another specialty, there's another health record in that hospital, but they don't interoperate with each other. So I can't move my record from my primary care very easily to say, let's say I'm seeing a specialist in a cardiologist or somebody like that, right? That's still a very living problem in the US. And the US is also trying to solve that problem, or globally, everybody has accepted something called FHIR interfaces, and FHIR is the method, right? And now NDHM is built on the core construct of FHIR, right? And in a way, India has an advantage of really learning from all the 10 years of pain that more advanced countries went to, and they can leapfrog into NDHM, taking advantage at the right time of bringing this interoperability. And then everything that we talked about in the past, earlier comes to play, right? How we bring Ayushman Bharat to and treating everything as a resource, hospital as a resource, wheelchair as a resource, patient as a resource, doctor as a resource. So there's a universal database of hospitals, universal database of doctors, universal database of patients, and true consent management. So patients can truly give consent to release their records to other doctors. And I think the way NDHM is structured is absolutely cutting edge, very much at the global standards. And if I can go a step further, they probably set the right standard, for the world to follow, because India is just building what is not there, right? Whereas for the others, they have to fix what is already there. So fixing something that is already there is a much bigger problem than just building something new. So I'm very excited to be part of it. And also, what we want to do is follow these standards, and everything that we are building in this space of preventative behavioral continuity care, what we are going to do is we're going to open source everything that we build. So anybody is free to use whatever we build. It will be up to NDHM standards. And it is also okay for people to get it to the next level of innovation. And if there are some really creative entrepreneurs that make money out of this, we'll be the happiest people, right? So we want to facilitate not only just the basic healthcare for people for free, but also want to empower more entrepreneurs to take this further and make it even better.
That's definitely a very unorthodox way of setting up and growing the REAN's vision. It's a fascinating movie. We are getting towards the end of the webinar, and I have got a couple of questions from the audience. But I also want to ask everybody to put in, if they have any questions to ask to Steve, to Dr. Madan, to Dr. Rakesh, they can put them into the chat box, and we'll try to answer it today, or we will follow it up with another session. But let's go through a couple that I've already received, and feel free, Sri, Dr. Madan and Rakesh, to jump in from your perspectives. But this is an interesting question. And I think all of you touched upon this. Is how do we ensure things like privacy, patient consent in the digital health era?
Yeah, see, what NDHM is doing and working on an open protocol. So the database will be shared, and it will be the technology provider and hospital provider who will own the data. So the security and everything is to the provider and health service provider and hospitals and those who are retaining the records. The mandatory thing which will always be kept in mind will be patient consent. So here I would like to say that the Ayushman Bharat Fund, NDHM and the Government of India is very successful in completely digitalizing Ayushman Bharat. And now, if we can go through our last 2 years executing this, and we see that there is no paper involved in doing treatment of Ayushman Bharat patient. So this Ayushman Bharat is catering the bill of underprivileged population and that are enrolled in last SECC data, which is later modified, and the 2011 data is completely digitalized. And the process, since the patient comes to the hospital till the discharge, everything is online, paperless, and done on a simple laptop by the hospital and in connection with the state health authority and national health authority. Earlier, just there was things like you have to post the files and you have to send the records, and then the government send the amount to the concerned beneficiary hospital who are serving the underprivileged for free under this Rashtriya Swasthya Bima Yojana. So that was scaled with technology, and it was possible because of the technology front that now it is paperless, highly secure, and can be done, and the delay in the treatment for the patient can be minimized. So and this not only the future is that we are not only serving this only to the SECC data underprivileged population. Soon, what I think it will cover those all the Indian citizens, those who are having Aadhaar card, and those beneficiary of any government sector, central government employee, or any corporation or ESI and central board everywhere. So this is the future of Ayushman Bharat.
Fantastic. And from a
Santosh, I just want to add one thing.
Sure. Yeah.
Just basically from a security and privacy perspective, when we initially started and we really had the focus of countries like India and the Equatorial Belt that really we felt required this kind of care, right? And because of it's not just security and privacy is just a higher standard, but again, once I go back to the existing establishment and breaking into the existing establishment in advanced countries, we felt was more difficult. But interestingly enough, our work is being appreciated even in the US, and some really reputed organizations like what we are doing, and they're forcing us to meet a very high standard of security and compliance, like HIPAA security and compliance. And the reason I'm saying that is when we build that into our platform, everybody benefits, right? So even if it is a free, someone in really remote rural India is also benefiting from the same privacy and security standards that our platform is built with. So I just want to emphasize that.
That's excellent. That's excellent. Maybe we have some time for one additional question, and then we can close with closing marks. How about patient safety? And because there is a lot of this remote care, self-care kind of thoughts going on, especially from a clinician perspective. Dr. Rakesh, Dr. Madan, how do we ensure that what's being done about that?
Patient safety, basically, I will say, if we compare the traditional way of healthcare management with digital way, like I have experience of 15 years in healthcare setup in government sector. if we say traditionally, the record of patient move physically from one department to other department in government sector. Suppose we take example of any medical college in India. If suppose patient is admitted in medicine department and or she has to take consultation from surgical department, then they have to take the file from one department and go to the other department. During these transits, many times record get missing due to human error or like misplacement during the consultation process. Even if we compare the privacy and security, traditional way is more unsecure and more lacking privacy as compared to the digital way. Like Siri said, the system is more compliant, HIPAA compliant, data is secure end to end, like data when moving from the internet from one place to the other place, it's encrypted form. And even at like when we are storing the data, it's encrypted. So no one else can have access to the data unless he or she has like access authorization to access the data. But in traditional way, there is no such kind of check and complaint. Data is open, your file is open. Like suppose if we say like HIV patient, government of India has made rule that no one should know the name of the patient if patient has HIV. But that is only on the paper. When patient has to go for consultation, he has like slip of HIV positive. Basically, he is disclosing his privacy. But if data is moving digitally, like from mobile to mobile, no other patient will know that he is HIV positive. So I feel that digital way is more privacy has more secure, and data is more secure in digital way than as compared to traditional.
Yeah, but I think Dr. Rakesh is very right that even privacy concern with before digitalization and after digitalization. So it is more useful. But I feel the challenge will be how to convert this data into the transferable form. Like, because it is difficult. If you will see the files, we have notes, we have surgical notes, we have physician notes, and they have presently been taken as a not any universal coding. So presently in the round of consultation, what have come up is that presently we have to keep open all the possibilities. We can share the PDF file, we can share the doc file of record, we can share the images, and we can share the snapshots. So over a period of time, when this data will be built in a universal language, then it will be transmittable, and in between the department and in between the doctors. So then gradually, obviously, we will go more and more universal, and this will take time. But whatever is present, whatever we are presently doing is very useful, and sure we surely the success is there, and we can see the change which is coming, and surely the healthcare technology will change this healthcare delivery system in India.
Santosh, just one very quick comment about safety. One thing I want to say is whatever we are doing is a companion aid for the patient. So really, in the interest of safety, the individuals using the app should only follow their doctor advice. App should only help them follow the doctor advice, not become the doctors. Right? So in other words, I would put safety back in the hand of the users, right? And use the app to aid and improve the safety, actually, not worry about reducing the safety, because they control it.
Very aptly put, and I really agree with all three of you about how we are thinking about this and how it is changing also those concepts. So that was really very good. We pushed a quick poll for the audience. I'm going to give them a couple seconds to do that. But we are really at the end of our webinar today, and Sri, Dr. Madan, Rakesh, thanks a lot for sharing all the thoughts that you had shared. For those of you on the webinar who are interested in learning more about what we are doing at REAN, please visit our website, and also feel free to reach out to us through social media or through direct email. We would be very happy to share our future plans, our current thoughts with you, and of course are very open to work with all of you in these endeavors. Before we close, Sri, Dr. Madan, Rakesh, any closing thoughts?
Yeah, just one thing I want to say is everything we are doing as of today is just our thought of what is useful to the end user. And we are not by any means married to our thought. What we are most focused on is the outcome. So whether it is to take care of your parents, grandparents, children, sibling, anything that you believe is helpful, please voice your opinion. Please share your thoughts on the forums that Rakesh mentioned earlier. And what we want to do is what matters to you. The last thing we want to do is what we think matters to you, right? So please participate. Please give us feedback and help us. Be part of the mission to improve healthcare and wellness in India and abroad.
That's excellent.
Yeah. So what I request to the whoever is there in webinar, that focus on the preventive care aspect, keep healthy and make habits, and that is the aim of even REAN Foundation, that which is the most difficult part. But if we are determined to do, we will surely do it. And whatever your thoughts, opinion and doubts are there, you can put your question on forum, and we are all ready to answer that, and we will surely connect with you and try to provide the best possible solutions.
What I will say is that digital health will not only bring transparency in healthcare sector, it will also decrease the cost of treatment. And secondary opinion will be biggest gift of digital health to the patient. Secondary opinion is always getting more and more important in current setup of healthcare when there is commercialization of the healthcare. So I will say, as soon as patient will adopt the digital health and ask the doctor to prescribe digitally, the more quicker the healthcare will be more affordable. This is my message. Like Sri said, if we compare the UPI is successful because end users are accepting it. If I compare 5 years ago, if I say someone that we should transfer money online, they were not willing to do that because of security issue, privacy issues, etc. But even if we compare today, you must be seeing a lot of jokes or meme on social media, LinkedIn. Even beggars have UPI code now. This shows that how it's successful, how we got success in UPI. And same kind of success I want in digital health. Every doctor, every patient, every chemist should use a digital mode of data transmission. And it will improve the healthcare also.
Very well said.
Fantastic. That's a tall vision. Thanks a lot once again, Dr. Madan, Dr. Rakesh, for today's webinar, and we will keep doing these for our audience in future. Thank you everyone for attending today's webinar. As mentioned, please visit us on our website. Feel free to reach out to us, and we will be happy to provide you with information. Thank you.
Thank you so much.
Thank you all. Thank you, Santosh.